Okay, this video is about why did Chef AJ get lung cancer? And of course, I don't know for certain, but I'm just going to share with you that there's an increasing incidence of women who do not smoke cigarettes getting lung cancer. And there's multiple reasons for this. Number one, they can have a genetic predisposition. Number two, Chef AJ worked as a chef, and they'll often inhale a lot of fumes. They can inhale fumes in particular off non-stick cookware with fluoride in it, the POFA and whatnot. But just inhaling fumes from cooking can be very toxic to the lung. So of course it's good to have an overhead vent to just suck out the fumes from the cooking. It's also good to have the windows open when that's possible. In addition, she lived in Los Angeles, where there's a lot of air pollution, and air pollution increases the risk of lung cancer. In addition, there's the chem-you-know-what trails in the sky, which is not good for the lungs. Let's see, what are some other things here? I'll show you some of the other pictures. I got a whole bunch of slides on this. Okay, here's just a couple of the papers showing, association between lung cancer and ambient particulate matter. Okay, well this one would be for air pollution. Here's cooking oil fumes and lung cancer in U.S. persons. Another one about risk of lung cancer in people who do a lot of cooking. So you got to really make sure you have the place well ventilated. Here's another one, and people who work in restaurants have a real high rate of that, because in restaurants they tend to fry more food, so that's going to increase the risk of lung cancer. Here's another paper on oxidative stress as a biomarker for people who work in kitchens where they're cooking a lot of food, and there's the fumes. So I'm just letting you know, there's a whole bunch of papers on it. Exposure to cooking oil fumes, chronic bronchitis, non-smoking women, increasing the risk of lung cancer. Another one coming out of China, cooking oil fumes and whether or not they use a fume extractor. Okay, the fume extractor reduced the risk of 50%. So that's a pretty big difference in lung cancer, 50% reduction by just having an overhead hood to suck out the cooking oil fumes. Another one, lung adenoma, adenocarcinoma promotion by air pollution. Okay, this is again another paper showing increased incidence in some women who have some mutations and a genetic predisposition to it. And Chef AJ mentioned that she had multiple family members who had died of cancer rather younger than expected, suggesting, she felt that she had a markedly increased family history risk factor there. Here's another one about genetic predispositions in India to lung cancer. And here's another paper about some of the different characteristic mutations of people who are especially vulnerable to lung cancer. I'm simply showing you all these papers to make the point. There's a lot of data on all this. So again, my attitude is always assume that you've got the normal variant or the genetic predisposition to get a disease, and then just optimize all your health parameters. Optimize your diet, your lifestyle, everything else, and try not to live in a place with a lot of air pollution. So here's a paper about air pollution particles increasing the risk of lung cancer, and I think that's probably the last paper I got here. Yeah, so anyways, hopefully she's going to do okay. She's actually, I heard her whole lecture there. She's had it for a long time, and she's surviving pretty well, and she still looks pretty good. A lot of lung cancer patients, they undergo surgery and radiation, and they have a hard time. So she has, anyways, she's doing pretty good, and I hope she continues to do well.